What is the role of a breastfeeding medicine physician? Hi, I'm Cindy Rubin. I am a breastfeeding medicine physician myself and a fourth trimester doc in the Chicagoland area. Breastfeeding medicine docs fill a very specific role as part of a team of lactation providers and caregivers. I am seeing a patient right now that is a great illustration of this. So this mom was sent to me by a lactation consultant in the community who had been working with her on low milk supply. They had increased the amount of frequency that she was nursing, and they had added some pumping sessions and made sure that she was pumping with correct flange sizes and settings were good. And all of that looked really good, but still her milk supply was not improving over time or was not increasing over time. The lactation consultant had a hunch there might have been other things going on, and she was at the limits of her scope of practice to be able to really offer anything more for this patient. So she sent her to me, and I was able to get a full history, do a physical, and come up with a plan. We ordered some labs, which all came back normal, but that was the way we were able to rule out some medical problems that could have been contributing to what was going on. And we were able to start some herbs and medications to help to increase supply. That, along with a lot of things that the lactation consultant had already been suggesting, started to bring up the supply. And then this patient was able to go back to the lactation consultant, get another visit, check the baby's ability to transfer milk and how much they were able to transfer. And we worked very well as a team, providing convenient and accessible support where and when this patient needed it, to the full extent that the patient needed it, and allowed her to achieve the vision that she had hoped for with her breastfeeding medicine journey. And we're not always able to have such great results and answer all of the questions and fix all of the problems. But this is where the team approach is really important. There are limits to a lactation consultant's scope of practice, which may make it so that they can't do the further workup or the labs or the diagnosis or the treatment that's necessary to help someone. And there may not be another physician like an OB or a pediatrician in the area who really got the training that a lactation medicine doctor gets in how to care for these problems. So this is a great example of one specific issue that can go to a breastfeeding medicine and lactation doc, of which there are many, many things that we can handle, but oftentimes best to work with the other lactation care providers in the area.